I'm Dr. Shad Morris, the owner and inventor of Slumber Bump, our positional sleep therapy device, and I'm bringing this video to you to discuss what I think is an often overlooked part of the sleep study and part of the overall treatment of our patients that have obstructive sleep apnea. So positional sleep therapy, or positional therapy, what we call it in our industry, is often overlooked in the overall assessment of our patient, but it is basically offsetting the effects of gravity during sleep when we notice a big increase in the AHI in the supine position versus all other positions that the patients sleep in. Positional sleep therapy is very effective just because we have a lot higher compliance rate than we do possibly with the CPAP for sure, and even with the oral appliances. I've found after 18 years of treating sleep apnea with oral appliances that positional therapy is about 85-90% tolerated versus the CPAP or some of the other surgeries out there. Okay, so I developed Slumber Bump so I had an effective way to keep my patients off their backs in the supine position. And that's why we developed the Slumber Bump. So it's inflatable, it collapses down, you can travel with it, and it's very tolerated by our patients. We have a high compliance rate, and it makes a big difference in that final sleep study that we're sending back to our referring sleep physicians. The answer is absolutely yes. Slumber Bump is a standalone treatment, positional sleep therapy, but it augments the efficiency of our oral appliances, the Inspire surgery, and also the CPAP. I've got examples of all of those, but they augment each of these mainstream therapies for obstructive sleep apnea, and it's a therapy unto itself when indicated with the sleep study. Another decision I made early on in 2013 when I invented this was not to make this a prescription product. The whole goal being so that we could bring access to care to the patients what's affordable. Yes, insurance will cover it on the E-code, but it's also can be found on the consumer side, so we have better access to care, a wider reach to be able to help more people that may or may not come in to see us to address the serious issues of snoring and sleep apnea. So, as you're aware, there are many studies going back to the early 1900s of how effective positional sleep therapy is. And just for an example, this is a WatchPat 1 disposable that I did on myself 2 weeks ago. And you can see the huge discrepancy from the supine position, 17.1, versus non-supine 1.5, which gives me an overall AHI of 3.5. To me, the math is really easy. We eliminate the supine position, we alleviate that 17, and now we have an average that's closer to 1.5 than to 3.5. And those are the results that I'm seeing. About a 50% decrease with no treatment at all, and about a 50% decrease in AHI when we make the oral appliances, and then it varies on the Inspire surgery and also on the CPAP. I wanted to get this video out to you all as our great American Academy of Dental Sleep Medicine has made a groundbreaking statement in the last month with oral appliances being first line of therapy. And I believe as well that positional sleep therapy needs to be right up there. It's either grossly ignored on purpose, or there's a lack of education in recognizing the positional component of obstructive sleep apnea that needs to be addressed. There's no other industry in health that I can think of where we start off with the most aggressive, costly, least tolerated procedures such as the CPAP and some of the surgeries, then starting out with more tolerable, cost-effective, and really effective as well, such as positional sleep therapy and the oral appliances that we all do.